Let us bring in Dr. Marty Makary, professor at the Johns Hopkins School of Medicine and the Bloomberg School of Public Health. Joins us on the phone. It's been a while. Dr. Makary, good to talk to you again, sir.
Great to be with you, Vince.
Are we beyond this phase where we need to find out that Jill Biden has a COVID case?
Well, first of all, I wish her well. I'm sure as she recovers, Dr. Fauci and the crew are going to be pushing another vaccine dose because they've got one that they're brewing up and it'll be approved in about a week. This is a new COVID vaccine. But, this whole protocol about you wear a mask for this number of days and all this stuff, it doesn't matter. The only option to avoid COVID is to live in profound social isolation. And I don't think I want to see that. I wouldn't wish that on anybody. So, I would like to say there's something you can do, but the reality is there's very little you can do beyond stay home if you're sick.
Yeah, they're out pushing these new vaccines again. In fact, here's Coringe today saying this very thing.
As we head into the fall, we have more tools and systems available today to help communities this fall and winter season, including safe, updated vaccines that will be available mid-September, widely available at-home COVID tests, widely available effective treatments, which can reduce the risk of severe illness, hospitalizations, and death.
Okay, but isn't it the case, Dr. Makary, I saw you writing on this subject recently, that this, once again, this latest jab that they're pushing out hasn't even been tested for its efficacy?
Well, was that Corinne Jean-Pierre, by the way?
Yes.
Okay, that's misinformation. She is spreading misinformation. To say that there's a new COVID vaccine that is effective, there is no human outcomes data whatsoever on it. So, where is she getting that from? Is she pulling it out of her butt? Because there's absolutely no human data on it. Now, but this is the new system. The White House declares something as safe and effective and then tells the FDA, you go and approve this and make it work somehow. I don't care how you do it. But we got Pfizer on the phone, and we've got to make this work. So the American people have rejected this entire notion, this whole process. Last time they tried to push the novel bivalent vaccine last fall, remember they said, hey, we have a whole newly designed COVID booster shot called the Omicron-specific bivalent vaccine. Only 17% of the country took it. And some of those people were required to as a mandate for their job or school.
Yes.
So the American people are I think they're laughing at this.
Corinne Jean-Pierre also said that Joe Biden, while he is indoors, I mentioned this at the beginning of the segment, is going to be wearing a mask when he's close to other people. What sense, if any, does this make in light of all of the endless data we now have on masks?
Well, telling people that masks reduce the transmission of COVID is misinformation itself. We have now the definitive Cochrane study. Now, Cochrane, just by background, puts out the ultimate gold standard comprehensive reviews in science. They gather every article ever published. They reanalyze data. They have an independent team of doctors and scientists review the results, and they put out the final word. For decades, whatever Cochrane says has been adopted as the gold standard, as the authority of evidence. Well, they just did the giant analysis of masks, and guess what they found? Reviewing 150 studies on masks, they found there was zero benefit in changing the trajectory of the epidemic. No benefit whatsoever. So he's, going against that study. Even Fauci was challenged on it, and he couldn't respond to that study.
Yeah, I noticed. We played some audio yesterday of that, but just to kind of, summarize what we heard, Fauci was arguing something to the effect of, well, that's on a population-wide basis. The data aren't that clear on the efficacy of masks, but on an individual level, it works. I can't remember a single time where a smaller sample size gave us better results, Dr. Makary.
That would be like saying, an appendectomy can cure appendicitis for an individual, but if you do it for a lot of people, it has no benefit whatsoever. That's the same logic that he's offering. And I know what he's getting at. He's getting at a study that showed if you put two people in a room and they have a tight N95 mask, then you can slightly reduce the transmission in that interaction if it's 20-minute or less interaction. But when you talk about telling the population to wear a mask, and most of these masks are not N95. Nobody can bear wearing a tight-fitting N95. Nurses can't even handle it for a shift of work sometimes. You're talking about an intervention that does not work. You're spreading misinformation. Look, I was hopeful masks could help. I really wanted them to help. But when you don't have anything that has science or efficacy, you don't just put something out there for the sake of saying, do this. Like, she said, we have a big toolbox now of what people can do to prevent COVID. I don't know what toolbox and Legos she's talking about, but there's very little you can do beyond profound social isolation.
Yeah. So I've noticed in recent weeks a number of headlines out of major Hollywood studios, for instance, a couple of colleges around the country, to include, I believe, Georgetown is still doing this, and a school that's just outside Atlanta, all imposing mask mandates as the students arrive back at school. Is it your position, it sounds like it is, that is a senseless requirement?
Well, they're flying in the face of the Cochrane Review and all the other science that shows that this is completely worthless. Georgetown, they're also writing on stone tablets and telling people that, opioids are not addictive, probably, and other, folklore and stories of Goldilocks. I'm surprised at the number of medical leaders who do not read the studies. And when the CDC director was asked about the Cochrane Review, this authoritative review showing masks don't help, she said, yeah, but they used a lot of randomized controlled trials in that analysis. That's called a strength. That's not a weakness. Fauci tried to say, well, there's some other studies out there. But when the guy who wrote the Cochrane Review, the Oxford professor, heard that Fauci was trying to say, oh, but there's other studies out there, he was like, no, there's not. We included every study in the analysis. He just doesn't like the results. We're in a new era of science. We've never seen this before. If there's research that gives you results that you like, then you cite it and point to it even if it's flawed. And if there's results you don't like, you downplay it and you negate it. And that's, unfortunately, the new partisan public health environment that we're in.
Yeah, absolutely. And in fact, I just want to share some breaking news of the visual that I'm consuming right now. Joe Biden, once again, is at this Medal of Honor ceremony. You just heard from the White House that when he's in close proximity to others, he will wear a mask. That is not what he's doing. He's standing next to a very elderly Vietnam veteran who he's awarding the Medal of Honor to. And the service member who's standing next to him, a young female, she is masked up. They've required her to be wearing a mask, the president not doing that. So even this idea that he's going to follow this guidance in the White House, he's already breaking the protocol they just established, Dr. Makary. And one other piece here, I can't help but notice, you and I have talked many times throughout the pandemic and over these past few years. I can't remember a time where you were this angry at all of these people. You sound like you are truly sick of their crap and done with it.
Yeah, the weaponization of medical science itself has just gone too far. It's one thing when you don't know and you just make something up. It's another thing when you don't know and there's definitive research that tells us the answer. And you can't ignore research on natural immunity for 2.5 years. You can't ignore research on masks for 3 years. You can't claim that school closures were necessary. Boosters and young people, the list goes on and on.
Yes.
All they're talking about is stopping misinformation. One of the greatest propagators of misinformation has been the United States government, and the evidence is right in front of them. So I am frustrated. You try to be objective. You always be, I was taught to always be kind, but we are seeing now a complete forfeiture of the entire scientific process, and it's a scary place to be in.
And it strikes me that the reason for that is all of the corrupt incentives at the highest levels of both government and in academia and in the science industry broadly. I'm going to do a story later in the show talking about the issue of climate science. There's an article today of a man who just got his piece published in Nature magazine, and he said he had to conceal some of what he knew about wildfires in order to get his paper published because Science magazine demanded essentially through the way that it publishes these papers that you hew to this political line that everything is about man-made climate change. And I'm reminded that Science Magazine, or excuse me, Nature Magazine is what I'm talking about. Nature Magazine is also the article that published that piece early in the pandemic, Dr. Makary, downplaying the chances that the virus came from that lab in Wuhan, and that's because of the same incentive structure.
That's right. That is the same journal. They've said that it definitely did not come from the Wuhan lab, and it turns out Dr. Fauci commissioned his friends to write it, even though those same friends told him they thought it came from the lab. So it's a very interesting time right now. I'm fascinated by the intense anger that a segment of the population has towards the unmasked, the people who don't want to go back to mask, the anger they have, the people who don't want to get this new COVID vaccine that's going to be approved next week with no human outcomes data, the anger they have at people who are unvaccinated. They have anger at everybody except the scientists that brew this up in the laboratory, the actual doctors that funded and created this in the laboratory. They get a pass. That's a very interesting social phenomenon.
Very interesting. Dr. Marty Makary, as always, grateful for your time and your wisdom. Thank you, sir. Nice to talk to you today.